Hello everybody, welcome to another presentation of some of the life-changing work that my team and I here at London Dental Specialists carry out on a routine basis. If you like these videos and would like to be kept informed of future episodes, please subscribe to our YouTube channel or follow us on Instagram and Facebook, London Dental Specialists and LDS Education for patients and dentists respectively. So here's the case for today. So this 44-year-old female was referred to see me because she had loose completely upper teeth and the back lower teeth. She also had pain, bad breath, and just a general lack of confidence with her teeth. So this is really what her smile looked like. In general, well, it's clearly obvious that the teeth have a slightly yellow and the gum is perhaps a little bit red here. But just looking at her smile, it's not immediately obvious that her teeth were very loose, but you will soon see some evidence for that. So this is the x-ray that I took as part of the general investigation. And the first blue line that you can see here represents the position of the bone levels when those teeth came out. Now, this yellow line also represents the position of the tips of those roots. So for those of you who don't know, if you have bone loss to the tips of the root, that basically means that that tooth is about to fall out. So you certainly do not want bone loss anywhere near the tips of those roots. And now this red line on this x-ray represents the actual position of the bone when the patient referred herself to me. And you can see the areas of most concern are the areas where the red line is close, right, to the yellow line. And that is generally on the upper right back teeth, upper left back teeth, which on both sides they've lost about 80 or 90% of the bone that was there, and that's where a lot of the major looseness was. On the upper front teeth, there's about 50 or 60% of bone loss. It is therefore not surprising from the previous photo that you saw that her teeth were loose and that they are sticking out slightly. And again, on the lower jaw, there's a similar appearance of really severe bone loss, so 90%, 95% bone loss of the back teeth on the lower right and the lower left. But fortunately, in her case, most of the bone around the front teeth appeared fine. So what do we do in this kind of cases? No matter what the options are, and there are always a myriad of options, the aim is to look at what's the patient complaining about and how can we address that complaint whilst keeping everything stable and healthy moving forward. So therefore, in this situation, it's either gum surgery plus braces to keep all the teeth, or extract all the loose teeth and replace ultimately the necessary ones. The ones that are necessary to satisfy her desire to be able to smile and eat with confidence. And for those of you who watched previous videos, in my humble opinion, humble but very strongly held opinion, that is a human right. So what did we actually do in this case? And there's one final thing. The one thing that was not obvious on the previous x-ray was this lower front tooth. I've pointed it out because that lower front tooth also had 90% bone loss, and that is really why it is sticking out so far out. So this is what we did. We extracted all the upper teeth and provided an immediate bridge of 12 new temporary teeth on dental implants. I then asked my orthodontist to place a brace in the lower jaw to bring the teeth together, because remember I said that this particular tooth here had 90% bone loss, so there's really no point trying to keep it. So we got the orthodontist to use a brace to bring the teeth together so that she can smile with confidence, okay? this final result is much better than just trying to replace all the teeth with dental implants. And that's why we have so many specialists or so many different types of specialists coming together to try and treat these cases properly. So again, this is what she looked like at the start, and this is her beautiful, absolutely beautiful smile at the end. The porcelain teeth were made by Unica Dental Lab, and Dr. Guy Xavier did the amazing orthodontic alignment of the lower front teeth. She was absolutely ecstatic at the end of treatment. How long did it take? It took about 12 months to complete, primarily because of the need for orthodontic treatment. We have a 10-year warranty on our implants, our London dental specialists, and this kind of treatment cost her approximately £20,000. And I know that in her case, she used some interest-bearing finance, because for us, we take great pride in treating everyday people. So why not follow exactly what she did, refer yourself, and my team and I are open and waiting to look after you, to give you the smile of your dreams. Thank you very much.